Let's be honest, we all know a shift starts before you even step foot in your unit. What you wear sets the tone for your entire day, and that's why I love Figs. Figs make scrubs for modern medicine. Back in nursing school, I was handed boxy, scratchy scrubs that felt like wearing a paper bag. Figs changed everything. They're form-fitting, insanely comfortable, and actually made for people who work in healthcare. They're antimicrobial to help keep you protected, durable enough for wash after wash, and look so good you actually want to wear them. If you're getting your first set of Figs, I'd go for the Catarina top and the Cade pants. The Catarina has this easy, relaxed fit that I love, and the Cade has cargo pockets for everything you need within reach. You can get 15% off your first order at wearfigs.com with the code FIGSRX at checkout. That's wearfigs.com, code FIGSRX for 15% off.
Are you looking for a podcast that your whole family can enjoy that asks the deep philosophical questions like, do trees fart?
If you are, then you'll love Tumble, a science podcast for kids. I'm Lindsay.
And I'm Marshall. Join us as we explore stories of science discovery, from butts to animals, dinosaurs, astronomy, and everything in between.
You'll love these stories, and you'll learn something new.
Find and follow Tumble Science Podcast for Kids wherever you get your podcasts, or at sciencepodcastforkids.com.
Hello there, I'm Nurse Mo, and welcome to Mo's Monday Minute, a shorty episode of the Straight A Nursing podcast where I share a quick tip you can start using to improve your practice or habits right away. For more in-depth topics, check out the episodes that I release on Thursdays. In this mini episode, we're looking at why magnesium is used in preeclampsia. So if you want to take a deeper dive into preeclampsia, go way back, and check out episode 68. Wow, that was over 400 episodes ago. Wowza. Notice how young I sound. I'm just kidding. I probably recorded that episode in maybe 2017 or 2018, so it's been a hot minute. Before we dive into that, though, let's just talk very quickly about what preeclampsia is. We're not going to go into the whole thing, but just a general overview is that it is a pregnancy complication marked by hypertension, like new onset hypertension, plus signs of end organ dysfunction, commonly protein in the urine, which indicates kidney damage. And the reason we get so worried about preeclampsia, not only is there potential organ damage going on, but it can progress to eclampsia, which is seizures, and we definitely don't want that. So big role for magnesium in preeclampsia because it is used essentially for seizure prevention. We're not giving the magnesium to control the blood pressure. Patients will be taking antihypertensives for that, but if they are getting into seizure potential territory, then we are using magnesium sulfate. And the reason is because it will depress the central nervous system basically, and it reduces neuromuscular excitability, and it raises the seizure threshold. So when we say we're raising the seizure threshold, we mean that we're making it basically harder for the brain to go into seizure. We're raising the threshold for what will trigger a seizure. So magnesium in preeclampsia or in eclampsia is typically given as a loading dose, 4 to 6 grams-ish of magnesium sulfate given over like half an hour or so, followed by a maintenance dose of 1 to 2 grams per hour. And of course, this is going to depend on your protocols, your physician orders, all of that. But just know that's kind of a ballpark range for what you might see. And then the medication, the magnesium infusion, is continued for a period after delivery because eclampsia can occur after delivery as well. So magnesium, even though it sounds really, friendly and you can just go buy magnesium at the grocery store, Giving it in this way, IV, really high alert medication. So it is given very slowly, and you are monitoring this patient very closely. They're going to be on a monitor. You're looking at respiratory rate because one of the things that magnesium toxicity, when there's too much mag in the system, it can cause respiratory depression. So you're keeping a really close eye on their respiratory rate. You can check deep tendon reflexes because they will lose those DTRs with magnesium toxicity or too high of levels. You're looking at urine output, just making sure that, we're not getting maybe some other electrolyte imbalances happening on top of this, and looking at level of consciousness. And we're looking at, of course, their serum mag level because we're going to be checking their level periodically throughout this therapy. So again, the signs that the mag level could be too high: loss of those deep tendon reflexes, again, respiratory depression, that's a big one. I have seen patients with mag toxicity need to be on a ventilator while we're clearing that mag out of the body, hypotension, bradycardia, decreased level of consciousness. So those would be things that you would see with very high levels of magnesium. So the treatment or the antidote for magnesium toxicity is calcium gluconate. And we're going to give this slowly, and basically it inhibits magnesium at the neuromuscular junction. So that is essentially how the calcium gluconate works. One thing to know about it is that if the mag level remains high, then that calcium effect can wear off. So the patient may need additional dosing and will continue to need close monitoring until their mag levels get down to normal. You may see diuretics used to help clear the magnesium. That could be another option as well. So that is your quick overview of why magnesium is used in preeclampsia, a condition that can lead to seizures. It can lead to pulmonary edema, liver problems, maternal and fetal death, like all kinds of things that are not good. We don't want to happen. So magnesium isn't going to fix it, but it is going to buy some time. It is going to raise that seizure threshold so that hopefully we're not getting neurological injury, neurological complications with that eclampsia and preeclampsia. So there you have it. That is your quick Mo's Monday Minute on magnesium and preeclampsia. See you soon. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.
This episode is brought to you by Athletic Brewing Company. No matter how you do game day, on the couch, in the crowd, or manning the snack table, Athletic Brewing fits right in. With a full lineup of non-alcoholic beer styles, you can enjoy bold flavors all game long. No hangovers, no buzz, no subbing out for water in the second half. Stock the fridge for tip-off with a variety of non-alcoholic craft styles available at your local grocery store or online at athleticbrewing.com. Near beer, fit for all times.